Hey, I'm Tamara Kendacker, and you're listening to the Decibel from the Globe and Mail. So last week, Canada's Chief Public Health Officer, Dr. Theresa Tam, said the words that none of us wanted to hear.
The latest national surveillance data indicate that a fourth wave is underway in Canada.
This, despite 60% of Canadians being fully vaccinated, and it comes as provinces are weighing walking back precautions and as schools are about to reopen. This wave is being driven by the highly infectious Delta variant, and it's going to look different from the previous ones in terms of who's infected and who ends up in the hospital.
This Delta version, after that third round of transmission, that one case relates to 216 new cases on average.
Cynthia Carr is an epidemiologist based in Winnipeg, and she's on the show today. We're going to talk about how this wave will be different for vaccinated people versus unvaccinated people and what it means for the end of the pandemic. You're listening to The Decibel. Hi, Cynthia. Thank you so much for being here.
Thank you for having me.
So we've been hearing that we are in a fourth wave, and I just wanted to start off by asking you, how does this wave look different from the previous ones, the first, second, and third?
Well, when we talk about new waves, we're not just talking about an increase in cases. Cases can go up and down, as we've seen throughout the course of this pandemic. A new wave means a couple of things. Typically, it means something about the virus has changed, and certainly we know that with all of the discussion right now about the Delta variant. So what we're seeing now is the patterns of quick a spread amongst our unvaccinated population. So the good news is that the vaccines are holding strong in terms of protecting vaccinated Canadians against the most severe health outcomes. So we're not seeing that same kind of relationship between exponential increase in number of new cases, hospitalizations, and deaths. But also on the positive side, vaccination is doing its job and protecting those who are vaccinated for the most part against the most severe consequences. But on the challenging side is the exponential ability of this version to spread. So just as an example, the first kind of wild virus version of COVID-19 that was in Europe and came to Canada, on average, it was estimated that one person could kind of infect 2 to 3 people. So after the third round of transmission, this would mean that first case could be related to 27 other people. So one person infected 3 others, who infected 3 others, and then 3 others, so at 27. This Delta version, after that third round of transmission, that one case relates to 216 new cases on average. So just to put in perspective how that increase in transmissibility absolutely matters, and it will look for anyone who is not vaccinated as a primary target.
And speaking of how infectious this virus is, how is the Delta variant spreading, and what makes it more infectious than the others?
So just as a reminder, when you come in contact with a virus, it gets into your cells, and once it's in the cells, it makes literally millions and millions of copies of itself. And when you make millions of copies of anything, there can be mistakes. So when that mistake works in favor, a slight alteration to the virus, that is the version that will take hold. So what's happened with the Delta virus is a couple of things. One is it's even better at kind of, let's just say, being stickier to your cells. So once it gets through your respiratory system, it's really good at attaching to your cell, holding steady there, and then getting into the cell. What makes it even more serious is once it's in the cell, it's really good at making lots and lots of copies, meaning that you're carrying lots of that viral load. And the more of that viral load you have, the easier or the more of it is available when you're talking or sneezing or coughing, or even just kind of breathing around other people if they haven't been vaccinated and you're close enough for that virus to transmit.
How likely is it that a vaccinated person can spread the virus?
So even without a variant of concern, no vaccine is 100% effective. And it's really important to remember that the way in which these were tested in clinical trials was about symptomatic illness, hospitalization, like the most severe health outcomes. What we learned along the way, because, with billions of people vaccinated, was through different trials and studies, is getting a sense that it was actually really good at preventing transmission as well. What we're seeing with the more transmissible Delta variant is that there is some reduction in the ability of the vaccine to prevent transmission. What the data are showing is that a vaccinated person, if you are one of the few that does get infected with COVID-19, you can still carry the same amount of viral load up in your nasal passages, for example, but the vaccine is protecting you from it getting down and making you really sick, getting into your lower respiratory system. But because you can carry that same amount of virus as an unvaccinated person, although you are protected from getting very sick, you could still pass it on. So although it's not zero, data out of Ontario, for example, show that over 99% of patients in the ICU are not vaccinated. So again, although you might have a small percentage chance of becoming infected, you're very unlikely to become very ill, but you could pass it on to somebody who is not vaccinated, and then they could be at risk of serious consequences.
So we're seeing a patchwork of precautions across the country, and some provinces are ditching precautions completely. Almost all the public health restrictions in Alberta were lifted on July 1st. Same with Saskatchewan. Is this the time to be walking rules back? What are the risks that we're facing here? And are we likely to see the healthcare system become overwhelmed, which has been kind of the big fear throughout the pandemic?
Right. So certainly the World Health Organization, in even again just most recent messaging, has reiterated the risk of inconsistent public health policies and actions. Because we are a highly interconnected society, even with trying to stop international flights, those kinds of things, we still interact continuously with other people. And so if we have one policy in one province and another policy in another, this virus works the same way. So any openings that are available in one area will ultimately impact another area. I think that we need to be really careful and cautious, particularly moving into the fall. We know the virus likes the colder weather. The more you bring people indoors in spaces where the air is recirculated, not wearing masks, more kind of talking to let those particles be more likely to be in the air, the more risk we're in. And of course, that describes the school setting, and we need to keep our children safe. And that is why it is so important that adults be vaccinated so that we can protect our kids under the age of 12. There is some data showing that there are more severe health outcomes starting to show for children under the age of 12. That data particularly is coming out of the United States, where there are too many pockets or groups of adults that are not vaccinated transmitting to children. And even things that are kind of statistically unusual or rare, the more people you have, the more opportunity those rare events are to occur. So the more infection starts amongst our kids under the age of 12 with this highly transmissible variant, the more opportunity there are for those severe health outcomes.
And you mentioned the stories that we're hearing out of the US of more severe outcomes for children. What do we mean when we say severe outcome?
So the numbers are still low, but when we talk about severe outcomes, we're talking about illness that results in hospitalization or mortality. I'm not talking about mortality right now. I'm talking about hospitalization. So what they're seeing in the United States is that there's an increase in younger people being hospitalized for COVID-19. And I can't see that we've seen that as much in Canada yet. But what we need to do is learn from larger populations that have kind of more cases to work from to see what could happen here in Canada. And again, reinforce why for all of us who are eligible, it is incumbent upon us to get vaccinated, both for our own protection, but also to protect those children under the age of 12 who are not eligible. And if we do not control community spread, the schools cannot open, and if open, cannot remain open, because the community spread is what pushes in to the settings such as a school or, hospital or other vulnerable settings.
We're seeing a patchwork also of vaccine mandates and vaccine passports emerging across the country. So some provinces like Quebec and BC and Manitoba seem to be embracing mandates and certifications. And then we have other provinces like Alberta and Ontario that are rejecting vaccine mandates and vaccine passports. Also, the federal government has announced that all public servants are going to be required to be vaccinated, but they have not introduced a domestic cross-country certification program. And I wonder, should all provincial governments be embracing mandates and vaccine passports? And is this patchwork approach the best approach right now?
Well, a patchwork approach would never be the best approach. A targeted approach, though, would be. So that target approach can have multiple layers. One continues to need to be understanding what the barriers are for the final groups of people who have not been vaccinated, and what is it that will encourage or lead people to get vaccinated. In some cases, it is specific incentives, and that can relate to a passport. So, for example, the card that we can get in Manitoba, if we want to order it 2 weeks past our second vaccination, will allow you to enter a large event such as a sporting event where there are tens of thousands of people, where we want to be safe. In terms of the federal decision making, again, we have to think about what we're trying to achieve. Is it we're trying to get more people vaccinated? Is it that we're trying to lead by example for other Canadians that haven't been vaccinated? Or is it that we're trying to have people feel safe if they're in a setting such as a Crown Corporation or a federal government building that you are surrounded by people who have been vaccinated? So I'm not sure how far that will go to enhance trust if there's a mandate, but I still think the more people that are vaccinated, the better. And then in terms of being required to use it for air travel, interprovincial trains, for example, I think that's a positive, because pandemics happen because people move from place to place, then the virus takes hold, and then it becomes community spread.
People who are vaccinated are obviously very fatigued. Nobody wants to go into another lockdown, but governments are telling us that we can do certain things that feel risky, like dining indoors, going to indoor fitness classes without wearing a mask, socializing in groups without wearing a mask indoors. So should we be following the rules that are in place and doing whatever we're allowed to do legally, or should we be taking additional precautions on top of what the government says we can and can't do?
So if you, for example, have a medical condition or have experienced a medical condition that might make you vulnerable or more immunocompromised, obviously you should still continue to err on the side of caution. Make those decisions that work for yourself, for the people that you live with, for the people that you interact with. But we also know that this has had a significant impact on people's mental wellness, their emotional well-being. People need to connect. They need to be with others. So, with that, look at what are the rules. Always try to understand what the community spread is. We can't live in fear. We know that eventually the pandemic will end, but this virus will become endemic, meaning it's circulating in our communities and country like influenza and colds. That is our expectation. It's just the cycles will change. We won't see as much surging and hospitalization, etc., as more people are vaccinated, and more people also get some natural immunity along with vaccination.
Given everything that we know, is the goal of COVID-0 still possible? And how does the Delta variant change the end game for the pandemic?
So the Delta variant, just like any version that would become more infectious, makes it more challenging. So again, as we talked about this version, the estimate is one person could infect 6 to 8 other people. Chickenpox, the estimate is 1 to 10. Measles and mumps are even higher, with measles having the highest reproduction rate of one person could infect 18. But we don't talk a lot about measles outbreaks or mumps outbreaks because we have effective vaccination. So again, we shouldn't be too frightened by hearing it's becoming more and more infectious. We'll never get on top of it. That is not true. We will get on top of it with more people being vaccinated and then more people who have had some contact with the virus, the natural immunity on top of that, not instead of. So we know that we can get to rates of low circulation probably for the most of the year, but we might get to situations, as I said, that's more seasonal, like the cold or like influenza. The concept of completely eradicating a virus is very challenging. It's only been done once. That is with smallpox. So that's the only human virus that the World Health Organization has announced as eradicated globally, whereas other, such as, polio, for example, has been eradicated from most of the world. So certainly over time, potentially we might reach a goal of 0, but I think it won't be anytime soon. And we need to stay on top of this with continued vigilance and vaccination, particularly of our most vulnerable groups.
Okay, Cynthia, thank you so much for doing this. I really, really appreciate it.
Well, thank you for having me.
That's it for today. I'm Tamara Kandaker. Our producers are Madeline White and Kasia Mihailovich. Michal Stein edited this episode. Rebecca Weston is our intern. David Crosby edits the show, and Angela Pacenza is our executive editor. Thank you so much to Cynthia Carr. If you want to email us, you can reach us at thedecibel@globeandmail.com. If you want to reach me, I'm on Twitter at Anima_TK. We always want to hear from you. Thank you so much for listening, and I'll talk to you tomorrow.